Today we're going to talk about bone tissue. When we discuss the skeletal system, it's composed of bones, cartilage, ligaments. Remember the definition of ligaments? It's the connective tissue that connects one bone to the other. Tendons is the part of the skeletal muscle that connects to the bone. And we'll talk about other tissues that stabilize and connects to them. There are two major subdivisions of the skeletal system. There's the axial skeleton, which includes 80 bones. It'll include the skull bone, the facial bones, the vertebra, sacrum, and coccyx, and it also includes the ribs and the thoracic cavity. The appendicular division contains 126 bones. It'll include the clavicle, the scapula, upper limb bones, the pelvic bones, and the lower limb bones. So let's look at some functions of the skeletal system. First of all, it's supportive. It forms the framework that supports the body and cradles the organs. It's a form of storage for minerals and lipids. Within the skeletal bone, it's a reservoir for minerals, especially calcium and phosphorus. And within the medullary cavity of the long bones, in yellow bone marrow, we store triglycerides. Within red bone marrow, through a process of hematopoiesis, we produce blood cells, red blood cells, white blood cells, and platelets. The skeletal system also functions in protection, protects some of our vital organs, including the heart, brain, and spinal cord, and allows for movement with force, leverage. So the skeletal muscles connect to the skeletal system, and as the skeletal muscles contract around our articulations, it allows us to move. So let's review this a little more in detail. So protection. Here you could see how the ribs in the thoracic cavity can protect our heart and lungs. The skull bones protect our brain, and the vertebra protect the spinal cord. Within the skeletal system, it's where we store minerals that include calcium and phosphorus. We store them in the bones, and through a process of resorption, we break down bone tissue in order to absorb when we need calcium and phosphorus. Here's the medullary cavity of a long bone, and that's where we have yellow bone marrow, and this is adipose tissue or triglycerides. The skeletal muscles attach to bones, and when they contract or shorten, they allow us to move around our articulations. We talked about how within the skeletal system, we produce blood cells within red bone marrow. It's a way we produce red blood cells, white blood cells, and platelets through a process called hematopoiesis. This red bone marrow is present in the fetus and some adult bones around the pelvis, ribs, sternum, vertebra, skulls, humerus, and femur. Usually the shape of bones reveals some information about the function. So let's look at long bones. Long bones, limbs. Here's the humerus, radius, ulnar, and phalanges. Also in the lower limb, the femur, tibia, fibula, and the phalanges. Short bones, an example of a short bone could be the carpal bones and the tarsal bones in the feet. Irregular bones, a nice example of this are the vertebra or the bones of the vertebral column. Flat bones are shaped in this is a nice example of the sternum and also the bones in our skull. Sesamoid bones, a nice example is the patella. It's kind of a flat little disc that exists in the tendons, and in the example of the knee, it assists with the reduction of friction as the tendon moves, the tendons around the knees move over the knee joint itself. So this is a brief overview. We'll go into each of these areas in more details. The anatomy of a long bone. This is a humerus. So the shaft is called the diaphysis. The ends of the bones is called the epiphysis. So this would be called the proximal epiphysis because it's closer to the midline, and this is distal epiphysis. In between the metaphysis and the diaphysis, in between the diaphysis and the epiphysis, there's a region called the metaphysis. And within the metaphysis, there's a region called the epiphyseal line. We'll talk about this in more detail in a minute. At the ends of the bones, we have articular cartilage, which is made up of hyaline cartilage. And this is at the ends of the bones. This would be called the proximal articular cartilage, and this is the distal articular cartilage. This is a pad that reduces friction at the regions of articulations with another bone called the joint. Periosteum is a thin layer of a double layer of dense irregular connective tissue that exists around the outside of the long bone and inside of the medullary cavity, which is a space inside where we house the yellow bone marrow, is a connective tissue called periosteum. We'll learn that bone is made up of two types. There's sponge bone up here, and it's always surrounded by a layer of compact bone. So let's go into each of these areas a little more in detail. So the diaphysis of the bone is a tubular shaft, and generally it's surrounded by compact bone, and the inner part of the diaphysis contains the medullary cavity, and within the medullary cavity it contains yellow bone marrow, which this yellow bone marrow is how we store triglycerides within the bone itself. Talking about the medullary cavity, it also decreases the weight of our bones. If we were solid bones throughout without cavities within the long bones, we could add like another 50 pounds to our weights. The epiphysis is at the end of the bones. The one that's closest to the midline is called the proximal epiphysis. At the end is the distal epiphysis. At the ends of the epiphysis, we have these thin layers of like a little pad called hyaline cartilage. So hyaline cartilage is important at regions of connections between one bone and other at the joints or the articulations, and they are shock absorbers. So it's important to note that this articular cartilage lacks a perichondrium. Okay, so it lacks a perichondrium. Remember when we talked about tissues, we learned how cartilage is avascular. So what the method that it gets its nutrition is through a thin layer of perichondrium, which supports the cartilage, providing it nutrition. Where articular cartilage lacks this perichondrium, so when it's injured or damaged, the repair is very, very limited. But we'll learn in the next chapter when we study joints, the articular cartilage is located in areas of the synovial capsule, and what provides nutrition to the articular cartilage is the synovial fluid. So in between the diaphysis and the epiphysis, there's a region called the metaphysis, kind of in the middle. And this is a region that contains either the growth plate or the epiphyseal growth plate or the epiphyseal growth line. So you have to differentiate one from the other. The epiphyseal growth line, when you see the line, make sure you understand understand that this indicates that the bone has stopped growing in length. When you see a plate, you know it's probably an X-ray of a growing individual. And this growth plate has a layer of hyaline cartilage and allows the diaphysis to grow in length. The periosteum is a strong double layer of connective tissue that's a protective tissue around the bone tissue, the bone itself. It has an outer fibrous layer made up of dense, irregular connective tissue, and it assists in how tendons connect to the bone. And then there's an inner osteogenic layer, which has osteoblasts and osteoclasts. Osteoblasts, we'll learn, are bone building cells, and osteoclasts are bone resorption cells. The periosteum is richly supplied with nerve fibers, blood, lymphatic vessels, and allow the blood to enter the bone via the nutrient foramina. We'll learn later also the periosteum assists with fracture repair. There is an endosteum within the medullary cavity, and there's osteoblastic bone-forming cells within it. So let's look at this again in greater detail. Here's the diaphysis. Here's the metaphysis. Remember, the metaphysis is in the middle of the epiphysis and the diaphysis. Within the metaphysis is where we have either the epiphyseal line, where the bone has stopped growing, or the epiphyseal plate, which we could see in a growing bone in length. So on this image too, we could see the articular cartilage on the ends, which is like a thin region of hyaline cartilage. Remember, this is avascular and lacks a perichondrium. Bone tissue is made up of spongy bone, which has bone marrow, which is where blood cell formation occurs, or compact bone, which exists around the outside of the bones, outside of the spongy bone, and the outside of the medullary cavity. Here's the periosteum, which forms a nutritional blanket around the bone itself, contains nerves, allows the nutrient artery to enter the bone. In the center is the medullary cavity. You can see on this image how spongy bone, you could actually see what we call a trabecular pattern with the unaided eye, and then around the outside is the compact bone. So this is a closer up image of the spongy bone. You could see the little pores, kind of like a sponge, and the compact bone around the outside. So in review, the spongy bone contains the red bone marrow, and this is where, through the process of hematopoiesis, we produce blood cells. We produce red blood cells, which are important for carrying oxygen, white blood cells, which are part of our immune system, and platelets, which are the clotting factors of our blood. Within the metaphysis is where we either have the epiphyseal line or the epiphyseal plate. How I remember it is, plate is in children, like they want to play, and the line indicates that the bone has stopped growing. It could be from ages 14 into your early 20s. Bone is always surrounded by compact bone. Spongy bone is always surrounded externally by compact bone. Here's the periosteum, that connective tissue sheath around the outside, and then inside of the medullary cavity exists endosteum. So here's an image of an X-ray, an X-ray of a child, and here is an image of the ankle. This is the tibia, fibula, and this is the talus. Okay. So the tibia looks like this line. So this is what an epiphyseal plate looks like. When we look at x-rays, bone tissue is going to look whiter. Soft tissue will either look dark gray or hollow spaces will look black. So because hyaline cartilage is cartilage, it appears like a black line or almost like a fracture through the tibia. And you can see the similar line in the fibula. So when we see this on an x-ray, we know this is a child or the bone is still growing in length. Once there's maturity, the child matures, this line will form a plate, and this indicates a growth in length, not in width. So let's go over some general terms that you should start memorizing. This will help you when you start memorizing the details of bones. So depressions or openings, fissures, foramen, fossa. These are spaces or little holes, for example, in the skull bone where cranial nerves pass through, or vessels. Sulcus is a little space. Meatus here, you can see this space here again. There's an internal auditory meatus and an external auditory meatus. It's the ear canal. Tubercle. This is a humerus. Generally, it's a little round, small projection where tendons and ligaments connect. Crests. This is called the iliac crest. If you put your hands on your waist, you could feel those. Lines or little ridges. Spines are little pointed processes. This is an example of the spine of the scapula. In the anterior pelvis, we have the anterior superior iliac spine, or anterior inferior iliac spine. In the back is the posterior superior iliac spine and posterior inferior iliac spine, areas of tendons and ligamentous insertions also. When we look at some of the long bones, usually this area that's more proximal, we call it a head. It's an expanded articular end. In this case, it's in the epiphysis, and generally at the base of the head is the neck. A condyle is a smooth articular process. A trochlea is also a grooved articular process. When you see the term facet, it's usually a flatter, smaller articular process. So start memorizing those terms, which will help you when we start memorizing all the bones in the body. So let's look at the histology of bone. We were already taught that bone tissue is going to contain a matrix surrounded by cells and fibers. So in this case, we've got a variety of cells that we'll talk about. The matrix is made up of 50% water, 30% of collagen fibers, and these collagen fibers provide flexibility and tensile strength. What that means is it resists the breaking under tension. Doesn't mean that a bone can't fracture, but the collagen allows it to be somewhat flexible. 55% of bone is crystallized minerals, which includes calcium phosphatase and calcium carbonate. And often, these are the minerals that we need for our the functions of our functions. So these are the minerals we break down through a process called resorption. When we hear the term calcification, it means the hardening of this extracellular matrix, allowing these minerals to crystallize. So let's look at the different types of bone cells that are present. So osteogenic cells, they're the bone stem cells, and they're in the mesenchyme, and they eventually develop into osteoblasts. So when you see the suffix blasts, they're the immature form of cells, and in this case, they're bone building cells. And these bone building cells secrete the collagen and also form the extracellular matrix. Osteocytes, when you see the suffix cytes, they're the mature cells. And in this case, osteocytes are the mature bone cells. And the important part of these is that they maintain the metabolism of the bone tissue through the exchange of nutrients wastes within the blood. Osteoclasts, they are located in the endosteum, and they're a form of white blood cell, and their function is in resorption, or the breakdown of this extracellular matrix. So here's an example of what they look like. Osteoprogenitor cells, again, develop into osteoblasts. Osteoblasts form that extracellular matrix, and they become osteocytes. So the osteocytes are maintaining the bone tissue. When you see an osteoclast, their function in resorption, or the breakdown of this extracellular matrix. And this is an example of this process again. For your exam, make sure you understand the name of the cells and a specific function. So osteocytes maintain bone tissue. Osteoblasts are building the cells. The osteogenic stem cells are located in the periosteum, as well as the osteoblasts. And the osteoclasts are within the endosteum, and they're in the method of bone resorption. So as you can see in this image, let me put my little pointer on, we could see where these cells are located. So the osteocytes are located inside, in this case, the compact bone tissue. Osteoblasts and osteogenic cells are located in the periosteum, and osteoclasts are located in the endosteum. So in review of this, I'm kind of reviewing it a lot because you will be tested on the names of the cells and the functions. So again, the osteogenic, they're the stem cells, and they're within the mesenchyme, and they're producing osteoblasts. The osteoblasts are the bone building cells. They're secreting the collagen, and they're initiating the calcification of the matrix of bone cells. And they eventually become osteocytes. The osteocytes are the mature bone cells, and they're monitoring the nutrient and waste exchange of our bone tissue. And osteoclasts are they're derived from white blood cells, monocytes, and their function is in the breakdown of this matrix through a process called resorption. So again, nice mnemonic is blasts, bone building, clasts, or bone carving or cleanup cells. So we talked about how bone tissue is made up of major classes. It's either compact bone or spongy bone. So let's talk about compact bone. So this compact primarily is located on the outside or external layer of all bones, and it provides protection, support, and helps bones resist stress. So compact bone is arranged in units called osteons. You'll also see osteons as the Haversian system. And these osteons are repeated structural units that exist around our bone tissue, the compact bone, and they are the central part of the osteon is called the central canal. So what the central canal is, it's a longitudinal space that contains blood vessels and nerves. Around the osteon are circular plates of mineralized extracellular matrix called concentric laminae, and they surround the central canal. Within the concentric laminae, we have these little spaces called lacunae, and within the lacunae is where the osteocyte, or the mature bone cell, sits. Connected to the lacunae are these little canal space filled with extracellular fluid called canaliculi. So they connect to the lacunae and they connect to this central canal. And this is a means that can provide nutrition via these canaliculi to the osteocyte. So it's a way that oxygen can come into the osteocyte and waste or exiting the osteocyte. Interstitial laminae are spaces in between the osteons, and they're old concentric laminae, and they fill the spaces in between the osteons. Circumferential laminae are around the shaft or the external border of the bone itself. So blood vessels, lymphatic vessels, and nerves from the osteum penetrate the compact bone via these perforating canals called Volkmann's canals. We'll look at all this in greater detail. So in this image here, let's look at the osteon. This is the osteon. These are the units of osteons that exist within the compact bone. In the center of the osteon, we have these central canals, and they run longitudinally through compact bone, and they're bringing blood vessels into the bone and nerves. If you look at this image here, you can see these plates of matrix called concentric laminae, and the concentric laminae surround the osteon, and in the center of the concentric laminae is the central canal. In between each of these osteons, what fills the spaces in between these, it's called interstitial laminae. And then we talked about how the whole perimeter of the bone itself has the concentric laminae. So let's look at a close-up of one of these spaces of the concentric laminae. We see these little spaces called lacunae. And within the lacunae is where the mature bone cell exists, or the osteocyte. You can see it right here. So this is maintaining the health of the bone, the compact bone tissue. You see these little like canals, they're called canaliculi. So they're filled with fluid, and they connect to the vessels in the central canal, and this is where oxygen could get to the osteocyte via these little canals, and at the same time waste products and CO2 is exiting, going into the venous system outside the body. On the outside of the bone tissue, you could see the connective tissue called the periosteum, which is composed of an outer fibrous layer which assists in the connection of tendons, how tendons connect to the bone tissue. And then it has an inner osteogenic layer, which contains the osteoblast cells, or the bone building cells. Through the periosteum, blood vessels, lymphatic vessels, nerves enter the bone via these perforations called these Volkmann canals. You can see these spaces. So this is how the vessels enter, go up into the central canal, and via these canaliculi give the nutrition that's needed to the mature bone cells, or the osteocytes. Sharpie's fibers, you can see these perforating Sharpie's fibers. This is how the periosteum connects to the bone tissue. Now look at, spongy bone. So spongy bone is different than compact bone because it does not contain osteons. And they're always located, spongy bone is always located on the interior part of the bone. If we look at spongy bone, you could see what we call a trabecular pattern. So this is visible to the naked eye, and it looks like a sponge. There are these irregular patterns, and within these spaces is where we have red bone marrow that produces blood cells via hematopoiesis. So the trabeculae contain concentric laminae, has the osteocytes within lacunae and canaliculi, but they do not contain osteons. So the functions of these patterns help in the resistance of stress and transfer force without breaking. It also helps reduce the overall weight of the bones, and the trabeculae support and protect the red bone marrow. So where do we see these? We can see red bone marrow in hips, ribs, sternum, vertebra, proximal humerus, and femur. So this is an example of the two types of marrow, bone marrow that exist in bone. There's red marrow, and again, that's in the spongy bone, and through hematopoiesis we produce red blood cells, white blood cells, and platelets. And then we have yellow bone marrow within the medullary cavity of long bones, and this is where we store triglycerides. So this is an example of spongy bone and how we produce the red bone cells which carry oxygen. White blood cells are important for our immune function, and platelets that have the clotting factor. If we look at spongy bone, you could see it does not contain osteons, but it consists of laminae. So these are these plates. The laminae are arranged in an irregular pattern of thin columns, and they're called trabeculae. And the spongy bone also has the lacunae with the osteocyte and the canaliculi. Within the endosteum of the spongy bone, we have osteoclasts. And remember, the osteoclasts were the bone cells that promote resorption or breaking down the bone. And there's also osteoblasts that build bone. There is usually a balance between bone building activities, and which is osteoblastic activity, and bone resorption, which is osteoclastic activity. So this shows these patterns that are visible to the unaided eye called the trabeculae pattern, and you can see the spaces where red bone marrow is located in this area. If we look at bone tissue through a microscope, it appears, here it is, it looks kind of like a tree trunk, right? So in the center, you could see the central canal of the Habergian system. This whole circular pattern here is the osteon. So we know this is compact bone. You could see the spaces of the lacunae. You cannot see the osteocyte in here. And see these little lines that connect the lacunae to the central canal? These are the canaliculi. And these plates around the central canal are called the concentric laminae. So some clinical connections associated with this, one common one, especially in postmenopausal women, is called osteoporosis. So that means porous bones. Postmenopausally, females are no longer producing as much estrogen as we have in the past. So therefore, there's an increased resorption of the calcium from our bones and minerals, calcium and minerals. So therefore, the bones look more porous, and that makes women with, or men can get osteoporosis. The bones are easily fractured, and spongy bone is the most vulnerable to this. Osteopenia is when we take an x-ray and we can see the beginning of decreased mass in the bone, so it looks a little more transparent. The term osteomyelitis is where an infection travels into a bone. Paget's disease is an excessive amount of osteoclastic activity, and therefore the bones become enlarged and brittle and also easily fractured. So let's look at an image of osteoporosis. This is where you could see a normal pattern in a bone, and this is where there's an excessive amount of resorption of minerals, decreased osteoblastic activity, and it looks more porous. All right, so let's look at the blood supply for bones. So bones have a rich blood supply. Of bones containing red bone marrow have an especially rich supply of blood vessels. So blood vessels that enter the bone generally enter through different arteries. We have periosteal arteries, nutrient arteries that enter via the nutrient foramina, metaphyseal arteries in the metaphysis, and the epiphyseal arteries. The nerve supply to the bones consists primarily of nerves to blood vessels and sensory nerves applying to the periosteum. So you could see the image here, the periosteal arteries, the nutrient arteries via the nutrient foramina, metaphyseal and epiphyseal arteries. So we can see how the bones are very, very vascular, and they also have a rich supply of nerves. That's why when we fracture a bone, it hurts quite a bit. And also, for example, like bone cancer, I understand is a very painful type of cancer. And the periosteal layer of the bone is going to assist to a great extent in fracture repair, which we'll talk about in a little while. So we also have the same supply of veins, metaphyseal, epiphyseal veins, periosteal veins. So this explains the pain associated with fractures or bone tumors. So let's talk about bone formation. Bone formation happens in two ways: intramembranous ossification and enchondral ossification. Enchondral ossification is the more common one. Ossification means the process of tissue becoming bone. So intramembranous ossification is the least common one, and it's the way our flat bones develop, specifically the flat bones of our skull. And let's talk about how that happens. So it develops into the skull, face, mandible, and clavicle are developed via the intramembranous ossification. So what happens is initially there's a development of an ossification center, and osteoblasts begin to secrete extracellular matrix, and there's a calcification of these bones as the extracellular matrix hardens, and then we develop the formation of trabeculae that will eventually develop into spongy bone, and then we develop the outer layers of the periosteum which develops into the periphery of bones. So this is not very typical, and it's how a lot of our smaller flat bones develop. The more common bone, which develops into the rest of the bones, is called enchondral ossification. So in this method, what happens is we initially develop a cartilage model of what the bone that's going to become. So as we could see, bone tissue originates as cartilage. That's why histologically it looks very similar. So eventually this cartilage is going to, via cell division, develop into a primary ossification area, which will develop into the diaphysis, and then this cartilage is eventually replaced by bone. We develop the outer layer of the periosteum, the spongy bone. The development of the medullary cavity begins to be broken down via osteoclastic activity. And we start to develop the secondary ossification centers, such as the epiphysis of the bone, the formation of the articular cartilage and the epiphyseal plate. And then about 12 weeks of, you could see a 12-week-old fetus. The areas of red represent bones that are becoming to calcify. You can see certain clear areas that represent uncalcified areas of the bone. So bone growth, developing the cartilage molecule, is in review here. So I'd like you to understand and kind of write this out for your exam, because you will have to know the order of the bone growth development in the enchondral model. So enchondral model is the growth, the cartilage model grows in length by mitosis and through the deposition of extracellular matrix. In contrast to the growth of cartilage in thickness, which is mainly due to more extracellular matrix at the periphery of the bones, the periphery of the bone. So this is an example of how growth occurs in length. So that's the replacement of cartilage of bone by enchondral ossification on the diaphyseal side of the epiphyseal plate. Remember, we learned when we see this plate is that area of hyaline cartilage where growth is occurring in length. There's different regions. The growth of resting cartilage, which is near the epiphysis. We've got the growth zone of proliferating cartilage, which is undergoing interstitial growth. Growth of hypertonic cartilage, where this cartilage is beginning to mature, and then zone of calcification. So this is how the growth in length occurs. Usually this will stop between possibly ages 14 to 21. And then at that point, you will see an epiphyseal line rather than an epiphyseal plate. Sorry, I'm losing my voice here. So the growth and length of long bones involves interstitial growth and the replacement of cartilage via enchondral ossification on the diaphyseal side. So growth and thickness occurs on the areas of the periosteum. So what happens, the periosteum fuses together and osteoblastic activity occurs, building new concentric laminae, allowing the growth to occur in width. So you can see here an infant long bone, and through this process we can thicken the bone and grow in width. So some terms we have to learn is the difference between bone remodeling, which is bone resorption, and this occurs through osteoclastic clastic activity, and it's how we're breaking down to remove minerals and collagen fibers from bone. And it's a continuous balance with bone deposition through osteoblastic activity. Sorry, I'm losing my throat here. So let's move on to understanding bone fractures. So when we're studying bone fractures, there's a variety of terms we have to learn. So when you see the term an open fracture, that means the bone has broken through the skin. Closed fracture, the bone has not broken through the skin. A comminuted fracture means that it's splintered or the bone has crushed into pieces. So obviously, an open fracture and a comminuted fracture often will require surgery. Green stick fracture means that usually you see this in kids where the bone fractures like on one end and the other end it kind of bends. You see this very, very common in children. Impacted fracture, for example, if you fall on your wrists and the bone actually just kind of compresses or becomes impacted. Pott's fracture is a fracture of the distal fibula in the ankle. Colles fracture is a fracture of the distal radius. And a stress fracture can occur where it's just a splintering. You see this a lot in athletes. So let's look at what these look like. A simple fracture, often this is treated just a cast. Compact fracture, it exits the skin and this would require surgery. This is an example of a green stick fracture where one end stays connected and the other end bends. Comminuted fracture, it breaks into small pieces, and this is an example of an impacted fracture. So let's look at these. The open fracture, the bone actually protrudes through the skin, where opposite to this would be a closed fracture where it does not exit the skin. You could see this example on the x-ray. Comminuted fracture, the bone is splintered into small pieces, and this will require surgery. You could see how it would look on an x-ray. Green stick fracture, it's partially, it's a partial fracture on one end, and it continues to be connected on the other end, usually in kids. Impacted fracture, on one end, the fracture bone is forcefully driven into the interior of the other, kind of it's compressed. Pott's fracture. So this is one that we often see on our exam. So Pott's fractured is a fracture of the distal fibula, often associated with a ligamentous injury in the ankle. Colles fracture is a fracture of the distal radius. So let's talk about bone fracture repair. So it follows a specific pattern. Initially, when we fracture a bone, we form what's called a hematoma. So blood rushes to the area, and it produces almost like a mass clotted blood around the fracture site. So that's why it's important after a fracture, you need to immobilize the joint to allow for a fibrocartilaginous callus to form around that hematoma. So phagocytic cells come to the area and clean the dermis. If left immobilized, eventually what forms is a bony callus. So this is where we begin to form new trabeculae and a fibrocartilaginous callus. This generally begins to harden after about 3 or 4 weeks after injury, and then eventually after a couple of months will become a firm union. So bone remodeling will also depend on the availability of minerals and vitamins, and eventually weight-bearing exercises and the proper hormones. So again, what we need to initially form would be a callus. So initially we form a hematoma around the injured site, and if left immobilized, then we begin to form a fibrocartilage soft callus. The white blood cells are cleaning all the derbis, and then eventually we'll form a bony callus, and eventually, at times, the healed fracture will sometimes even be non-visible on an X-ray if it heals properly. This usually should take approximately 6 to 8 weeks. So in this last phase of bone remodeling, we're removing the dead bone fragments, the reabsorbed and compact bone is going to replace spongy bone. So as we mentioned, a well-healed fracture is sometimes undetectable on X-ray. It will take weeks, 6 to 8 weeks, depending on the severity of the fracture. So as our bone ages, we begin to lose bone mass, and they become a little more demineralized and brittle, which makes older individuals a little more susceptible to fractures. So factors affecting bone growth and repair is the availability of minerals, calcium, phosphorus, vitamins such as A, C, D, K, and vitamin B12, and hormones, which include insulin, growth factors, and thyroid hormones. We have reached the end.